I am the Deputy Minister of Health and Alternate. It's tragic and should not happen. Mr. Speaker, a never event human being died this way. Mr. Speaker, we have the ministry has, as the Honorable Minority Leader said, has constituted a committee that is looking into the issue. And in fact, they have met today. We have also done preliminary inquiries. And Mr. Speaker, as we all know, I believe that the management of Kolebu Teaching Hospital has also independently interdicted some of their workers that were in the emergency room that night. However, Mr. Speaker, the conditions that run in the country, Mr. Speaker, the previous government started the Agenda 111 project, Mr. Speaker, at the hospital, trying to explain the circumstances, Mr. Speaker, Agenda 111. Mr. Speaker, Agenda 111. At the end of 8 years, Mr. Speaker, there was not one single hospital that was operational. Mr. Speaker, in fact, what we came to meet, that a human being could walk in, to the extent that, Mr. Speaker, the Auditor General surcharged 35 contractors, 7.9 million. Mr. Speaker, the current government is serious about what is happening in our emergency rooms. We have constituted a committee that is looking into it. We are collecting data as to what is actually happening in our emergency rooms. Mr. Speaker, the issue is multifaceted. Is it the pre-hospital, the ambulance, the pre-hospital care, or is it indeed what is happening in our emergency rooms? Mr. Speaker, in the last 5 years, the ambulance service personnel have not been recertified. Mr. Speaker, the ambulance was there because of the proximity to the ambulance service. They got there on time and they did what was necessary. Mr. Speaker, the issue of no bed syndrome, unfortunately, is not a new issue. This issue has existed in to solve the problem of no bed syndrome. Mr. Speaker, we are going to retool the hospitals, starting from the CHIPS compound to the health centers.
Major,
you said we should have it. Now, you've made a statement. She's commenting on it. And Mr. Speaker, just imagine the level of noise that is emanating from the other side. So, Mr. Speaker, can you imagine?
Listen to each other.
Yes. No enough hospitals and provide enough beds. You may disagree with her, but that's the beds. You may disagree with her, but that's it.
Honorable members from each side of the House. So kindly wait when it's your turn. Then you can put across your views. But honorable members, I thought we agreed on some key issues. You are a Deputy Minister of Health. Do you need a bed to attend to emergency situation?
By definition, unit. The cart in the ambulance can be considered a bed. So in such cases, a patient can be treated in the ambulance.
Yes. Even outside the ambulance.
Exactly.
Outside the chair, an emergency.
No, Mr. Speaker, the patient
so let's
can
move
actually
on, please.
Be constituted a committee because they had. Mr. Speaker, it is the bed plus the oxygen plus the IV plus the IV infusion itself plus the monitors plus everything in the ambulance. Mr. Speaker, an ambulance is not just a transportation device. So, Mr. Speaker, we are retooling the ambulances.
Deputy Minister, I was a minister for health. I know what I'm talking about. Please focus on the issue. The reason was that no bed. That is what we've been told.
Speaker.
So focus on that. You've done well by establishing a committee to investigate the issue. So let's look at it seriously.
Thank you, Mr. Speaker. We are retraining our emergency services staff. Mr. Speaker, we are both training the doctors as well as the staff. We are even training the security in the emergency rooms. Mr. Speaker, we are also extending this into the ambulance service itself. We are going to ensure that all the ambulances have the necessary equipment to save precious Ghanaian lives. Mr. Speaker, this patient could have probably been saved if we had the proper supplies in the ambulance. Mr. Speaker, we are working diligently to avoid such needless deaths of any Ghanaian. And in conclusion, Mr. Speaker, I would like to express my heartfelt condolences to the family, and I would also like to express my condolences to the rest of the country. Mr. Speaker, under our government, such incidences would not happen. Thank you.
Yes, honorable members, can we take two more from each side of the House? Yes, Honorable Kojo Opong Nkrumah.
Mr. Speaker, I'm grateful for the opportunity to comment on this statement for this tragic loss. What happened? Mr. Speaker, also, let me, on behalf of members of Parliament who may feel like associating with this call I'm about to make, apologize to the family of Charles Amisa for the comments that have just been made by the Deputy Minister for Health, which, in our view, attempts to politicize the matter. This is a matter of a tragic death, a matter that has now been announced as a subject of an investigation. There should be no basis for which, at this time, there are attempts to suggest that it is because the immediate past administration did not finish Agenda 111 buildings, or EM also did about that. I'm not sure what Ghanaians want to hear us talking about today is an attempt to be doing partisan exchanges on. What is important is that, more importantly, Mr. Speaker, is an assurance that going forward, the emergency health processes that should take place in our health facilities across the country are very strongly observed. But, Mr. Speaker, this happened in, imagine what is happening across the aisle. We have to commit ourselves to ensure that no cedi should be spared in ensuring that facilities and personnel are made available across the country to be able to attend to the health needs of our people. Mr. Speaker, once again, we would extend our commiserations to the family of Mr. Charles Amisa. But this should not be a matter that is politicized in any way whatsoever. Thank you, Mr. Speaker, for the opportunity.
Speaker, I'm so grateful. And just like my colleagues, I would also like to use the opportunity to extend condolences to the bereaved family. At the heart of this whole call during last meeting, and then unknown to me, I went blackout. The radio station this morning, and none of us was spared. Speaker, not even yourself. The public holds an erroneous view that we are not doing. That comes from our practitioner, for me, has to do with the fact that we have overly concentrated our health facilities in Accra. And so,
I'd like to commend the leader regarding the passing of Charles Amisa. And let me also express my deepest condolence to the family of Charles Amisa. Mr. Speaker, it saddens my heart. Why? Because just about 3 months incident that happened, Kumadan, there is no, they had to improvise. Mr. Speaker, any one of us could have a cardiac arrest, and it will take between our healthcare system agencies. We shouldn't have excuse the fact